This is CNN Breaking News.
I'm Bobbie Battista at CNN Center in Atlanta, updating one of our top stories now. Police in Evansville, Indiana, say there are fatalities after a military plane crashed into an Indiana restaurant and motel this morning. It is not clear how many people have died, but state police say body bags are being brought onto the site. Several people are believed trapped inside the burning restaurant at this time. The building burst into flames when a C-130 military plane smashed into it just a short time ago. Police and rescue workers are working to pull out survivors. Witnesses say the crash sent flames leaping 50 to 60 feet in the air, and a tower of black smoke can be seen for miles. Officials at Scott Air Force Base in Belleville, Illinois, say the plane had apparently just taken off from the Evansville Regional Airport. Eyewitness Tom Blevins, we understand, was on the scene, and he's on the phone with us now. Tom, what happened?
I had left the airport after picking the person up that I am right now meeting at the plant with, and both of us had watched the plane take off from the airport and bank towards the east over the plant, the Whirlpool facility that I work at. After turning onto the main highway, heading back to the plant and getting in the parking lot, I noticed the plane coming back from a westerly direction. It looked like it was making an attempt to land, but it was in a very steep glide banking pattern. The person that was with me has past Air Force experience, and we knew then that the plane was in trouble. And it took about 10 seconds. It just nosedived into the ground and exploded in a tremendous fireball.
Tom, I know that you're not perhaps equipped to answer this question, but do you know how many fatalities there are at this time, or can guess?
I have no idea the size of the fireball. My assumption is that the crew probably perished on impact. I have a supplier that is located within a block of the impact area of the crash and had talked to them, and that's when I first found out that it had struck the motel restaurant complex. The local news media is broadcasting warnings right now for everyone to stay away, and I am adhering to those warnings.
How close are you to the scene?
When we saw the plane impact, we were less than 1 mile from the impact. This plant is right at the edge of the runway where the plane took off and is less than 3/4 of a mile from the impact site.
And the fire is still burning at this time?
All we can see right now is smoke.
So you don't know whether the fire has engulfed just the restaurant, or is there also a motel in the area? Are we to understand that?
The restaurant and motel are all part of one complex.
Okay, so you don't know how much of it is burning at this time?
I do hear that the north end of the restaurant and the motel have been involved in the accident.
Okay, our thanks to Tom Blevins, an eyewitness on the scene of this military plane crash. Sandy Appler with the Evansville Regional Airport is also on the phone with us at this time. Sandy, the plane took off from your airport. What happened?
It is our understanding that at 9:58 this morning, C-130 transport plane was making a low approach to Evansville Regional Airport runway 22, and it crashed 1 mile south of Evansville Regional Airport into the parking lot of JoJo's Restaurant in connection with the Brewery Inn, which is on U.S. Highway 41 in that complex. The aircraft, it is our understanding, is based out of a guard unit at Sandifer Field in Louisville, Kentucky, and again was on low approach to runway 22 at Evansville Regional Airport.
All right, Sandy, we'll have to terminate that conversation as the phone call is difficult to understand due to transmission problems. Again, repeating the top story, a military plane has crashed into a restaurant and motel complex in the Evansville, Indiana area. We do not know how many fatalities there are at this time, but the complex is burning, and rescue workers are on the scene. We'll bring you more information as soon as it becomes available.
Eventually, we're going to have to join the rest of the 20th century and the rest of the other civilized countries and have a more nationalized health care plan.
You go to the doctor and the prices are outrageous.
My doctor, for example, has asked me whether I'm insured, and the price I paid was based on whether I was insured or not. It's a total ripoff.
The nation's health care crisis. From Washington, I'm Reed Collins.
And from CNN Center in Atlanta, I'm Bobbie Battista. Welcome to this special edition of NewsHour, an hour devoted entirely to a vital issue this election year, health care. 9 out of 10 Americans say the ailing health care system needs a quick cure. In less than 30 minutes, President Bush plans to take the wraps off his health care package aimed at addressing those concerns. and we will be bringing you the president's speech live. Watching with us to respond to his plan is a panel ranging from a hospital administrator to a Democratic senator wary of the president's proposal.
Well, from work to home, hospital to ballot box, the questions are how to provide the best care for all and then how to pay for it. The issue is edged onto center stage in this campaign year. President Bush, as we know, is now ready to spell out his plan. Traveling with the president today is CNN's senior White House correspondent Charles Bierbauer, who joins us now from Cleveland. Charles?
Reed, President Bush is setting the scene here first by visiting a Cleveland hospital due here at what is essentially a Chamber of Commerce luncheon to unveil the details of the plan shortly. White House officials say it has three primary objectives, and that is to tell people in this country how to find health care in the first place, particularly important for those who are unemployed, for the poor, or those particularly who work in small businesses that do not provide health care. Next, how to afford it. This will be done in several ways. For the poorest, those at or near the poverty line, there would be a credit of up to $3,750 for health care. This would be something of a voucher system through which they would receive health care up to $3,750 for families. For the middle class, those in small businesses, as we say, who don't necessarily have health care now, there would be pools formed to provide low-cost care. There would be a combination of credits or deductions which would phase out at varying income levels, starting at about $50,000 for an individual and $80,000 for families, by which time all the credits would be gone. And then the third point is how to keep health care. Two critical points in that. One is to enhance the ability of individuals to transfer the health care they have when they change jobs, and the other is to allow them to maintain coverage for existing medical conditions. One problem in many cases now is that if you have what's called a precondition, you can't get coverage when you change jobs or change health care. This boils down to what the White House, the Bush administration, is calling a health care choice between what, as they put it at the White House, a proven failure. That they say if you go along with some of the nationalized health care plans, such as the Democrats are proposing, either the Canadian system or what the Democrats call pay or play, well, according to the White House, you're adopting a proven failure. Their alternative, as they suggested, would be to reform what is already a high-quality system to include everyone and allow medical choice. Now, one thing we're not going to hear today from the president or the White House staff that's traveling with them is precisely how they are going to pay for this health care plan. It is described as a plan, not legislation. The cost is estimated at $100 billion over the next 5 years, and then an annual cost of about $35 billion. Officials that we've been talking with here say, well, if they're serious about this on Capitol Hill, then we're willing to discuss the ways of paying for it. Some of the things suggested, of course, have been to take some of the inefficiencies out of Medicare, Medicaid programs, cut down on the paperwork, standardize claim procedures, and put some caps on payments that are made now for Medicare. One other thing that is likely to be brought into this would be to increase Medicare payments for those in the highest income brackets, but that's only a fragment of the $100 billion that's needed. Basically, we are now setting the stage for a political confrontation where one administration official here said, if they're serious, if the Democrats don't say it's my plan or your plan, then we can go somewhere. Elsewhere, it may be up to the voters to decide. Charles Bierbauer, CNN, live in Cleveland.
Well, President Bush is unveiling his health care plan in Cleveland to showcase what he considers a good example of a working program. About 85 small businesses there have joined together in a group nicknamed COSY. That stands for Council of Small Enterprises. Together, these businesses are able to purchase employee health insurance at group rates.
It's unphenomenal what they're saving. We know that the rates have not gone up substantially more than 10 to 15%, and that's a lot lower than it was when our rates with the other carrier had shot up about 35%.
Over the long term, as the increases in the costs of our programs have been about a third the general rate of price increase among insurance companies doing business in the area, the savings magnify over time.
COSY's biggest healthcare provider is Blue Cross Blue Shield. That company says the COSY relationship is good for all sides.
And just ahead in this special edition of NewsHour, live interviews with some of the policymakers and participants in the national debate over health care. And a report on public frustration over that cost squeeze.
I'm working almost a week. just to pay my health care per month. 1 week for taxes and 1 week for your health care. That doesn't leave you a lot of time left.
Freedom's the one. Only one gum passes the test when you've got dental work, and that's Freedent. Freedent won't stick to your dental work, so you can be confident chewing it. And because it also moistens your mouth and freshens your breath, Freedent's in a class by itself.
Freedent's the one that took the stick out of gum, and Freedent moistens your mouth. Yeah, moistens your mouth and freshens your breath while you chew.
Non-stick Freedent moistens your mouth and freshens your breath.
Some people don't know it, but they're paying too much in taxes. Take these two, identical in many ways. Similar homes, similar income, similar investments. But one could be paying 28% more tax on his savings and investment income. That's over $200 on every $800 earned. The other called Fidelity Investments toll-free and found out how to invest tax-free in this free fact kit on Fidelity tax-free funds. It shows you how to earn income that's 100% free from federal income taxes. And in some states, your income may be free from state and local taxes, too. And there's no sales charge, which means all your money is working for you. So call for your free fact kit on Fidelity Investments tax-free funds. Call right now and you'll also get this bonus booklet, Understanding Tax-Free Investing. See how Fidelity gives you the facts you need to make up your own mind without pressure.
Hello, Fidelity?
Keep more of what you earn. Call 1-800-328-4100 today. Fidelity Investments. Common sense, uncommon results.
Ricola, the all-natural herb cough drop imported from Switzerland. Ricola has been soothing throats and relieving coughs naturally for over 60 years.
It's a party and you're invited. It's the Jam of the Year with a special appearance by Hammer, musical dynamos, and entertainers galore. The NBA All-Star Stay in School Jam, Saturday, February 8th, 12 noon Eastern on TNT.
There's no health care whatsoever in Bush's plan so far that I've seen that's realistic.
I think it's very wise to stick with what we got and just keep developing on it.
The taxpayer ends up picking up the bill one way or the other.
Anything they can do to help people get medical attention and medical care should be done. There's a lot of people out of work. I'm one of them. Yeah. And we need medical care.
Code Blue, healthcare in the United States is in a crisis. Does President Bush have a cure? Our panel on NewsHour today will watch the president's speech with us, then offer their reactions to his proposal. Joining us from our Washington Bureau is Senator Jay Rockefeller of West Virginia. Senator Rockefeller strongly supports health care for all. He has been an outspoken critic of the proposals offered in the State of the Union speech. John Rother is the Director of Legislation and Public Policy for AARP, the nation's largest senior citizen advocacy group. Deborah Spielman is also in Washington. She worked as President Bush's domestic policy advisor during his 1988 campaign. And from Miami, Dr. Joseph Simone. He is the Director of St. Jude's Children's Hospital, the nation's largest pediatric cancer facility. In these brief few months before the president's speech, let me ask all of you what you are listening for in the president's proposal. Senator Rockefeller? Senator Rockefeller, can you hear me? We appear to have some audio problems with the senator, so we'll move on to another guest at this time and get back to the senator in just a few minutes. Mr. Rother, can we ask you that question? Mr. Rother, can you hear me? No? Okay, we'll straighten out these audio problems and try Dr. Simone in Miami instead of Washington.
St. Jude's.
Dr. Simone, can you hear me?
We're delighted to hear that there's some kind of a plan in the works. That's the most important thing. But I think from press reports early on, the most important thing is how we're going to pay for this. Are they going to take money from Medicare and Medicaid and thus put the inner city hospitals in deeper trouble to pay for some other part of the plan, or what? So I think the most important thing is, are they going to shift money from one program which is underfunded to another program?
All right, Senator Rockefeller, now can you hear me?
Yes, I can.
Okay, good. We've straightened out our audio problems. We're asking all of our panel guests today what they are listening for in the president's proposal. And you? Senator?
You're on. Yes.
You can hear me. Okay.
Yes, I can.
What are you listening for in the president's proposal today?
what I want to hear is that we're going to have real universality of health insurance, not just access to health care, but people actually having it, and I mean everybody. And secondly, what's critical is real cost containment. Even if everybody has health insurance, it's not going to make any difference if the cost of health care goes up so sharply as it is now. Strong cost containment has to be the second pillar, along with access to health care.
Deborah Steelman, former Bush domestic policy advisor, what are you looking for? You probably know more than the rest of us what's in it.
Well, the president's going to give people a choice that they really need to make the most important decision on they will face in health care. He's going to ask people, do they want more government insurance and radical changes toward government insurance, or do they want some radical changes in the private insurance to give people better private insurance? I think Americans want some common sense in health care and some action right now, and that's the ball the president's going to start rolling today.
And John Rother with the AARP, what are you concerned about?
I think there are four things that any comprehensive plan has to address. First, the need for everyone to have coverage. Second, comprehensive benefits for those things that are most important to people, like long-term care, prescription drug coverage. Third, effective cost containment to keep it affordable. And fourth, and in this case I think most important, a fair and equitable way to finance the whole thing, because that's really what we need the leadership on.
All right, our thanks to all four of you, and we will be getting back to you for further comments after the president's speech. Reed?
Well, for many people in the United States, even those with health insurance, the present system is somewhat confusing, expensive, and frustrating. More now as we continue our series of reports entitled Democracy in America, The People's Agenda, with CNN's Brooks Jackson.
It's so expensive. For the coverage you get and what you pay, it's just unreal anymore.
It's 2/3 of a paycheck I have to put out every month.
It's the issue that disturbs me the most.
The cost of health care is rising out of control, a cancer on the U.S. economy. Medical costs have become like a tax on workers' pay. And in this election year, that tax is resented, both by workers and business.
This is the biggest problem, the issue of most concern among business people today.
Barbara Balter heads a family-owned construction engineering company. About 1/3 of small businesses offer no health insurance at all. And the rest, the Balter company included, struggle to pay the rising premiums and restrain the cost to employees.
We do a lot of juggling to try to keep the important coverage for the people. What you do is you keep whittling away coverage in order to keep the premiums affordable.
We already sent the binders up.
As the Balter company whittles benefits, employees like Kent Mossmiller find themselves getting less protection but paying much more.
I've been here 19 years. When I first started with them, I think I was paying about $10 a month for my health care, and now I'm paying $286 a month. I'm working almost a week just to pay my health care per month. 1 week for taxes and 1 week for your health care. That doesn't leave you a lot of time left, you know, for yourself.
9 out of 10 people in the U.S. are dissatisfied with the high cost of health care, making it a potent election issue. Between 31 million and 36 million Americans have no health insurance at all. Mostly they are working people or their spouses and children, like the wife of Balter employee John Bidenback.
It cost me an additional $240 a month just to put my wife on a policy. With what I make and the bills I have, there's just no way. Another dollar. See ya.
Bye.
How does she feel about going without insurance?
She hates it. That's all I hear every day is, what if I get sick? What are we going to do? And to be frank, I don't know. I really don't know what we're going to do.
Keith Edwards, another Balter employee, has no health insurance for his wife and their year-old baby. And that's all too common. 1 American child out of every 6 has no health insurance.
it'd take more than half of my paycheck to cover my wife and my child. I can just barely afford to cover myself now. Every day she tells me how she's afraid the baby's gonna have to go to the hospital or something. If he did, I have no idea what we would do.
Balter workers fear their burdens will become even worse. They say their government is doing nothing.
You write your senator, your congressman or something and ask what they intend to do about it. I don't see anything being done in Washington about it.
Barbara Balter's frustration with Washington runs even deeper. Fed up with the steady erosion in her workers' benefits, she went to Washington, lobbied Congress for change, and got nowhere.
It's a very, very difficult matter to get our representatives to understand a problem. They really don't understand the problems. They don't live the problems.
After we talked to Barbara Balter, her company was hit by a rate increase of 95%. They're trying to find another insurance company. The People's Agenda strongly favors change. 9 out of 10 Americans say the U.S. healthcare system is in crisis and needs to be repaired. In one poll, they say by 2 to 1, they want national health insurance financed by tax money. They're not likely to get that from Washington. Uncontrolled medical costs are both a paycheck issue for workers and a bottom line issue for big U.S. corporations. They are being crippled in the international marketplace. One domestic car maker estimates that healthcare costs account for $700 of the price of every car it makes. For Canadians and Japanese who have government health insurance, the costs amount to less than $250 per vehicle. Since 1982, medical prices have risen more than twice as fast as the general rate of inflation. A generation ago, only $1 US in every 17 went for health care, but now it's $1 in every 8, more than in any other nation in the world, and headed for $1 in every 6 by the end of this decade.
I don't have any insurance at this time right now because the insurance cost is too high.
Rick Dujardin is one of those millions who work and still cannot afford health insurance. But Rick's wife, Sandra, is living a nightmare, one that many Americans fear. She had health insurance at her job, but lost it when she needed it most.
I built my way up into the company. I became a supervisor. I loved my job. And then I got very ill. And my doctor told me, you either quit work or you're going to die.
Without income, she could not continue her health insurance. The disease that forced her to quit work is lupus. It's debilitating and sometimes fatal.
It's like something eating at your body. It's inside and you can't control it. I get blisters on my face. My joints swell just like somebody with arthritis. It's hard to walk sometimes.
Rick also has health problems, asthma. And since neither of them have health insurance, they go without medicine they need.
This one I can't take. That's a necessity, but I can't take it because it's $70. This one my husband can't take because it's $70. This one I can't take because it's expensive. This one I can't take. And this one I can't take. We had a choice one time to make of whether to buy food, groceries, or to buy prescriptions. Of course, I was real sick at the time, so we bought the prescriptions.
Rick and Sandra were married 2 years ago. To save money, they now live with his parents, but they dream of their own home and search for something they can afford.
We want a house just like everybody else. We want a baby. But, of course, the medical costs and the money, all that has to go towards bills.
Definitely not work.
Nice area.
For Sandra, it's a stark choice between the dream of a home or her health. Her doctor wants her to continue a series of $2,000 hospital treatments. Without them, her disease could grow worse.
You can die from it. It's a fatal disease. So that's why I want so much in life. I mean, you never know if I might not have the chance to get it.
Did you ever worry that something like this might happen to you?
No, who does? It makes both of us mad. You know, I'm sick, and you feel like it's the sick people that need the insurance, but that's not true. The only way you'll get insurance is if you're healthy. I'm always saying to him, you know, why can't the government help us? Why can't they come out with a health plan for people that have low income or normal income? Doesn't make sense.
I'm Brooks Jackson, CNN Special Assignment.
Republican and Democratic leaders disagree on how best to tackle the problem of rising health care costs. Most Americans disagree as well. We've asked people for their solutions to the health care crisis, and here are some of their answers.
Give incentives to somebody like the professional associations to regulate their own and to make their own the very best and the highest quality available in the world.
I think the basic health plans for children should be changed and old people, but there should be included a health plan for unemployment for people that don't work, but the people that don't want to work, I think that is a problem, a good ongoing problem.
Make it available to everyone. Right now, if I lost my job, I wouldn't have health care, and it'd be devastating to me.
You're going to have to find a way to eliminate abuse of the insurance system. It's the main problem you've got, people overcharging because they think the insurance companies can soak it up. They can to a point, but there's a limit.
There should be some type of governmental control on health care overall, to make it affordable for everybody.
It would be good when it would be socialized medicine like in Canada. I came from Canada. But maybe someday they'll do it. It will take time. We need money. Money has to come from somebody, right?
Well, President Bush is about to reveal his suggested health care package in Cleveland, and we'll continue with that in a minute.
Hey, there I go again. Yeah, you always kept me going. Dad, did you ever think to yourself, someday that little guy will have his own baby?
No, not really. I was too busy thinking, how can I afford to raise this kid?
Yeah, that's what I've been thinking about with Brian. How can I afford it?
Well, I'll tell you how I did it.
Since 1928, families have invested with Scudder, America's first family of no-load funds.
Imagine this is Florida, and that's Walt Disney World, SeaWorld, Universal Studios, Epcot Center. And this is Kissimmee St. Cloud, offering the closest and most affordable accommodations in the middle of Central Florida's best attractions. Call 1-800-358-KISS, and we'll send you our free vacation guide with information on affordable hotels and campgrounds. So if you can stay here, why stay anywhere else? Kissimmee St. Cloud. Location is our biggest attraction.
In a world no bigger than the sandbox, no deeper than the mud between toes, it's spray and wash that has gotten out the food, grease, and grass the little ones get into more than any other stain remover ever made. And that has given more mothers the quiet strength to send them back out into that little world to do it all over again. More than any other stain remover, spray and wash gets out what America gets into.
Updating our breaking story now, a National Guard spokesman tells the Associated Press that 5 crew members of a military plane are feared dead after the plane crashed into an Indiana restaurant this morning. Still no word on casualties inside the restaurant, but at least 5 persons were being treated for injuries at a nearby hospital. The restaurant burst into flames when the C-130 transport plane nosedived into a parking lot next to the JoJo's restaurant, then exploded in a fireball. A National Transportation Safety Board official says the plane had been practicing touch-and-go landings and takeoff procedures at the airport near the motel when it crashed. The C-130 reportedly was based with an Air National Guard unit in Louisville, Kentucky. To get back down to the occasion of the president's speech, we're still waiting for him to begin his address in Cleveland, and we'll go there live when he does.
Many believe it was the innovative spirit of Europe that inspired him. And when Mr. Ford came home, he created Lincoln Continental. Today, with computerized suspension, electronic transmission, and anti-lock brakes, Continental is one of the most advanced automobiles in the world. Lincoln Continental, what a luxury car should be.
With the uncertainty of today's real estate market, many would-be home buyers have adopted a wait-and-see attitude. Your Coldwell Banker agent, on the other hand, thinks it's time to wake up to the possibilities. Home prices may never be this affordable again. Interest rates may never be this attractive. Altogether, it's a great time to buy a home. All it takes is opening your eyes to the opportunities and knowing who to call. Coldwell Banker. Expect the best.
Mince fresh herbs and spices, slice or dice celery, onions, garlic, chop nuts, and make homemade pasta too. Introducing Roll-O-Magic, the hand-controlled food processor that works like a power mower, as its 5 supersized magical roller blades chop onions and minced garlic as coarse or fine as you like. Mince fresh parsley, basil, and dill. Slice or dice celery for salads or stir-fry dishes. Make carrot sticks and celery sticks. Turn cabbage into coleslaw or health salad. Make homemade pasta and noodles. Roll-O-Magic is easy to clean. Just wash and let dry. Its blades are stainless steel and never need sharpening. The pressure of your hand is all that's needed. Roll-O-Magic can be yours for only $19.95. Get a mincer, slicer, dicer, chopper, and pasta maker. Plus, you'll also get this special recipe book and guide to fresh herbs and spices.
Credit card users call toll-free 1-800-257-1257 or send check or money order plus $4 shipping and handling to the address on your screen. Sorry, no CODs. Credit card users call 1-800-257-1257.
This is CNN.
Well, as we continue with our special report this hour on health care, and we await the president's proposal of his health care reform package in Cleveland in just a few moments, let's go back to our panel of experts and analysts. We will be talking with them periodically through the hour with Senator Jay Rockefeller of West Virginia, with John Rother of the AARP, with Deborah Steelman, former Bush domestic policy advisor, and with Dr. Joseph Simone of St. Jude's Hospital. Deborah, let me ask you, skyrocketing costs is clearly a main concern for most Americans, and there doesn't seem to be any indication at this point that the president will address that issue directly in his proposal. Do you think that'll be an area of omission?
No, he's got a quite extensive cost containment proposal as a part of this. Basically, he sets up the argument that do people trust the government to contain costs, or do people trust the private sector and their own insurance policies and working with the hospital system themselves to contain costs? I don't think anybody's looking to have their insurance program run by the post office or the IRS. They want private insurance to work for them. And that's the proposal the president will outline. People want to know if they can get their insurance, if they can keep the insurance, and if the insurance is affordable. And the president's plan covers all 3 of those elements.
Senator Rockefeller, do you see it that way?
No, I certainly don't. In fact, he misses on all of those elements. There isn't any serious cost containment. We're not talking about government running a health care system. The health care system is running itself now on a voluntary basis, and that's what's gotten us in all of this trouble. That's why all the people on your pre-game show or pre-speech show are hurting so badly. We need cost containment and total access to health care coverage, and the president, unless he changes his mind right now, isn't going to deliver it.
John Rother of the AARP, much speculation about the president's plan to cut Medicare and Medicaid in order to finance this proposal. Will this hurt Medicare beneficiaries?
If the proposal does cut Medicaid and Medicare $100 billion in order to finance this plan, it would be reverse Robin Hood, stealing from the poor in order to fund a program to help the poor. I don't think that that's going to be in, at least I certainly hope not. I hope the president's reconsidered, because I don't think that would be very good health policy, and I don't think it would be a constructive approach to solving the problem.
Dr. Simone, for what you know of the president's proposal thus far, how do you anticipate that it will affect hospital care?
It depends on how it's funded, of course. If the insurance coverage broadens and covers more people, especially those who are employed and can't afford insurance, it would certainly improve hospital care and accessibility for people. But if it's taken from one pocket to put in the other pocket, then the hospitals will simply be cost shifting to try to cover those people who aren't covered, particularly in inner cities where this is a major problem.
Bobbie?
Yes, Senator, go ahead.
You know, the president has an enormous opportunity here. The American people are waiting for his leadership on health care. We're not talking about tinkering around the edges. I mean, the health care crisis in this country is massive. It takes massive reform to do not only health insurance availability, but also cost containment. I mean, what the people have to understand that we're talking about the second biggest problem in this country other than joblessness. Tinkering at the edges does not work. The question is, will the president provide availability of health care insurance for everyone in this country? And will there be top cost containment? If the answer is no, it's a flunk.
Senator, let me tell you the kind of massive reform I'd like to see. Right now, I'm a small business owner, and I'm trying to buy insurance for my 5 employees. We hired 3 new people, and we need to hire insurance to get insurance for everyone. The bids that we've received from the insurance companies, both of the 2 bids we got, exclude each of my employees for some condition for life. Now, I want insurance now. That's the kind of